My name is Jennifer McNeer. I'm a pediatric hematologist and an assistant professor of pediatrics at Comer Children's Hospital. AML is acute myeloid leukemia. ALL is acute lymphoblastic leukemia. They are both types of cancers of the white blood cells. AML, however, is a cancer of the myeloid blood cells, and ALL is a cancer of the lymphoid blood cells. The symptoms for either type of leukemia can be very similar. Some children present because their parents notice they look pale or they're very tired. Some children present because they're having a lot of bruising or other signs of bleeding. Other children present with fevers or bony pain. The symptoms are very diverse and sometimes very nonspecific. AML is diagnosed by obtaining a sample of the patient's bone marrow. The pathologist will look at the cells under the microscope. They will also do some other more specific testing called immunophenotyping. They'll look at chromosome abnormalities in the leukemic cells. They will look at any molecular changes in the leukemic cells. This helps us to better characterize each individual patient's disease and better guide their treatment. AML is treated with chemotherapy. It's actually quite intense and administered in the hospital on an inpatient ward. The chemotherapy is given intravenously through an IV. It's also given intrathecally, which means into the spinal fluid of each patient as well. Some patients with AML will need a stem cell transplant depending on how aggressive their disease is and how they're responding to therapy. We often start by looking within a child's family for a donor. And if there's no donor within their family, then we search the National Registry for an unrelated donor. The treatment of AML has evolved dramatically over the years. It's become a lot more specific to the myeloid cells. It's been intensified very much in order to improve cure rates for patients. Additionally, we are learning more and more about underlying genetic abnormalities in AML, and new drugs are being developed that target the specific genetic patients in patients' leukemic cells. I think the future of AML treatment is very much going to be tailored to patients more specifically than it is now. We are learning more and more about molecular changes that each patient has. New drugs are being developed to target these changes, and hopefully we'll be able to deliver more effective therapy that's actually less toxic for patients. I really enjoy the long-term relationships that I have with my patients. I really get to know the kids and their families well through the treatments, and it's nice to help guide them through this incredibly difficult time and then watch them recover from their illness and go on, and the kids get to be kids. The University of Chicago Pediatrics team has at its disposal the most up-to-date and novel ways to best characterize a patient's leukemia. We have access to state-of-the-art diagnostic testing, and we are active members of the Children's Oncology Group, which conducts clinical trials to bring the most up-to-date care to every patient with leukemia. Besides physicians and nurses, there are social workers and child life specialists who work very closely with families in order to support them emotionally and help the kids retain as much of their normal day-to-day life as they can while they're going through treatment.